Hey, good morning. Steve Stites, Chief Medical Officer at the University of Kansas Health System. Delighted to be back with you on this beautiful Friday morning, broadcasting live from the Dall Simons Family Studio. Happy to be here, and happy to with two great folks here, Amanda Cackler and Dana Hawkinson. We'll get to introducing them more in just a moment. But first, Hawkeye, Medical Director, Infection Prevention and Control.
Yeah. Numbers.
Let's give the numbers, brother.
You know, we're still good. We've been, what we say, quote unquote, good is relative to kind of, I think, the situation that you're in any running 14 or 7 days. But we've been really pretty good, a lot happier than we were, especially back in November, December. So 15 active infections with only 3 of those in the ICU. And only 1 on the ventilator, which is a really good thing. 31 still in that recovery period, so 46 total patients. Hays still has 10, but only 3 active and 7 recovery, so hopefully their numbers continue to go down too.
That is good news. And Amanda Cackler, Director of Quality and Safety, back in the house with us today.
Yeah.
This does make us feel a little better.
It does, absolutely.
Numbers.
I think something to add to the numbers is that we haven't seen an inpatient death since February 24th.
We're some
I know, which is an amazing trend because we were seeing them multiple every day. So I think that's some positive news.
I think to that, I think I just saw it was either an MMWR or a Lancet paper that was looking at vaccination. Again, Israel, because I think Israel had the largest rollout in their population. Reduction in ventilator infections or critical illness by 70% since the vaccine started rolling out. So that's a really good thing.
Approximately a very big deal.
Yeah.
And this number, do you guys remember when if we had been at 15 with 30, when it had been a total of 46, we would have thought the sky was collapsing. And now we're like, wow, this is so much better.
Mm-hmm. Yeah, back in April and May when we were in the teens, it was not good news. And now perspective has changed and it's much better than it was in November and December.
And just to say, I think part of the thing that has allowed us to survive, what is still a big number, that is still the single largest admitting diagnosis right now in the hospital, COVID-19, right? When we had a third of the hospital, it was really crazy. But now we have like 700 and some odd patients, and we have 45 of them with this diagnosis. That's still a really big number, but it feels much more manageable. Mm-hmm. And I think partly because, have you seen any influenza in the house?
No, and I need to ask again, but when I talked to Dr. Leesman a couple weeks ago, we had not had a single influenza case tested within our facility, both inpatient and outpatient, which is outstanding.
Crazy.
Mm-hmm.
Crazy. Yeah. Have you heard of any?
No, no.
What about RSV? Have you guys seen any RSV?
No.
Okay,
it's great.
See, there's only one reason, because vaccination for COVID does not protect against RSV. Clearly, influenza vaccination protects against influenza. But to have nothing at this time of the year, there's only one reason. It's because you out there are doing a great job with your masking, distancing, hand washing, coughing into your elbow, and not going out if you're ill. Keep up the good work. And I don't care what the politicos say about this. Masks work, and you still ought to be masked. Even if people are lifting mask mandates in some states, and perhaps they do have Neanderthal thinking, I don't know, as some people have suggested. But listen to Fauci. He's telling you the truth. And all you have to do is see how few people have influenza, how few kids and others have developed RSV, how very few other viral infections are out there right now, to know that masking and distancing really work.
And it really suggests perhaps the behavior shouldn't end, even with vaccination coming, as it relates to other diseases. And so I know people aren't going to want to hear that, but if you could change that seasonal influx of respiratory viruses, I mean, what an outstanding thing for everyone.
Well, and what we know is that when you get a viral illness, Hawk, it kind of starts a little bit of inflammation, and then that can cause other problems. So, I'm a lung doctor.
Yeah.
COPD exacerbations, emphysema exacerbations, asthma exacerbations are so frequently triggered by some form of viral illness. So if you don't get the virus, you don't get the asthma exacerbation, because the truth is our asthma and COPD numbers are down too. There's only one reason for that: infection control.
Yeah, not much more to say than that, And those are viruses and infections that don't even cause the same type of critical illness, really, that COVID does. So just that little insult or that little infection can trigger worse problems such as COPD or asthma exacerbation and a trip to the hospital.
Now, we're not saying you have to wear a mask 365 days a year once we got COVID conquered, although
Yeah.
Amanda may think that's right because that's what
We
she
may need to
believes
talk
in.
about it.
She has to live this every single day, so,
That's
she
what
may
she
be a
would
bit of a
like.
true believer.
Mask
But,
all the time.
but there is something to that, right?
Yeah.
And if you're a vulnerable person out in the population, especially with asthma, COPD, heart failure, all these other things, I think you might want to examine that because it's clearly making a difference.
Absolutely.
And I think in here, in the healthcare and hospital setting, when, your ultimate concern and care is what is the best thing for the patient, that's what we consider, and that is the best thing for the patient right now.
Does
is to
work.
do that. Yeah.
Let's see if there are reporter questions out there this morning.
Good morning, Cody Holyoke with
Cody.
KMBC9 News. Hey, you kind of touched on this a little bit, but I'm curious. Mid-America Regional Council saw something like a 90% drop in daily new cases from what we saw, I think, like a month ago in the metro. What's your
great.
confidence level? It is. What's your confidence level about how we're doing, and then what are your concerns? I know you touched on some of the other states, but what are some of your concerns moving forward so that we stay the course?
Wow, first of all, that is great news.
Yeah.
But Amanda, we're always concerned. What are you most concerned
I
about?
think it's being overly confident that we are over the hump and that we're just going to go back to normal life. And then we don't know what's going to come of that. And so I think we just have to be extremely cautious and not lose sight of we're not there yet. So keeping the infection prevention and control principles, you always say this, they follow you wherever you go. And I think we need to continue that until we know more about, I know we're learning now about asymptomatic transmission being significantly impacted. If we can make it through the next few months as we get more of the vaccine distribution, I think then we can start talking about changing our behaviors and returning to whatever the new normal is going to be.
Yeah, I think that's exactly right.
Yeah, I mean, I think it is. We are doing very well right now. I think, as a nation, much better than we were. Locally, I think we're doing quite a bit better than we were. My concern is, as you have alluded to and mentioned, would be variants. We know variants are going to pop up all the time. What is the significance of those variants? There's certainly some information to say that the B117 from the UK variant is more transmissible and maybe has a higher death rate. That is still being studied, but that's my concern is moving forward, will perpetuate. We know that in the Houston area, which is one of the hardest hit cities in America, they've identified all those variants that we've seen, yet they are loosening restrictions. So locally, can your increase in cases lead to increased hospitalizations and death? While we still have a low percentage of the general population that's vaccinated. But then also moving locally, because we know how easy it is to get in a car and drive somewhere or get on a plane and go somewhere. How will that affect the spread around the nation, particularly, in our area?
That's exactly right. I don't have much to add. You guys have said it well, but I'm going to say it a little differently. Don't get cocky out there, people, because you're doing a little better. Don't blow it. You're driving. This game's close. You're late in the third quarter. Don't fumble the ball at the 10-yard line. And I mean the opposition 10-yard lines. We are driving for another score. We can get it done. And to your point, Amanda, let's get everybody vaccinated. When it comes around about July 1, when we got a whole lot of folks vaccinated out in this country, then let's have another conversation. Because I would love to be back at Coffin with a full-throated crowd. I'll go with 8,000. I feel comfortable enough to go to Coffin now with 8,000, and I hope to be back at Arrowhead next fall. But gosh darn it, don't fumble the ball
Just
on the
like
10-yard
the
line.
Jayhawks against Baylor and last night. Just keep fighting and doing the right thing, and you'll have good outcomes.
Yeah, I think it's really important to acknowledge, too, that the interim guidance from the CDC has not changed yet. So until their evidence suggests it's time for change, I don't think that we have anything to back a change in our recommendations. And just yesterday, we had multiple calls with folks planning events in as early as April all the way through September, wanting us to provide guidance. And right now, we don't have that crystal ball to know exactly what events will look like in April or in September, so we just have to keep the course.
Cody, I got my sports example. Here it is. Seattle Seahawks against the New England Patriots on the Super Bowl 1-yard line. And what's Russell Wilson do? He throws an interception. Don't be that guy. Be Patrick Mahomes. 38 touchdowns, 6 interceptions. All right. I think
I was going, or you be Malcolm Butler, right, and grab the ball.
I like it.
CDC this week, and Amanda just touched on this a little bit, they paused plans to come out with guidelines for people who are vaccinated against SARS-CoV-2, saying they're still in the works. In the meantime, though, I'm getting a lot of questions from viewers about what they should do, especially now that more people are getting the vaccine. If a loved one who doesn't have or who doesn't live in their home is vaccinated or friends are vaccinated, what's your advice? Can people start to gather now and take their masks off around them? I'm getting that question a lot.
Oh, that's a great question. Let's take it on. Let's start first. You got a family of 4 or a group of 4. They've all been vaccinated.
Yeah.
Can they take their masks off when they gather in a house?
I personally am not doing that. If they're not my household contacts, I'm still a little bit reserved, probably. I know that there is more emerging evidence suggesting that the asymptomatic transmission is being impacted by the vaccine, which is great news. I think you mentioned it on when Dr. Alt was here, that it was like maybe a 75% reduction, or maybe Dr. Alt mentioned that.
But it's not 0.
But it isn't 0, and I think it really still takes into account, like, what are the, who are these folks? Are they, do they have vulnerable medical conditions? The transmission can still happen, so I think we just have to be extremely cautious. So I think we need to wait and see a little bit more, maintaining that social distancing. You can take your mask off if you can maintain the distance and you know, be very cautious of the ventilation within if you're indoors. You know, we've always said outdoors are better than indoors. So I am not ready to change much in
That
regards to
behavior.
guidance.
And to say, you may have asymptomatic transmission to somebody else who's been vaccinated, but that person could give it to somebody else who hasn't
Exactly.
been vaccinated.
So, yeah, so we're extrapolating asymptomatic transmission because we know that the Johnson & Johnson addendum data and also the real-world experience with the Israeli data from the Pfizer vaccine shows that there is a significant reduction in actual asymptomatic infection. So we hope that because of that, you are less likely to transmit the disease. Officially, yeah, the guidance is there's really no change. So we are kind of sticking with that. But anecdotally, if you even listened to Dr. Fauci a week or 2 ago, when asked about if he feels comfortable, finally meeting and getting together with his daughter again after it had been so long, he said that, we would feel more comfortable now because both she is vaccinated and past that 2 weeks to gain optimal immunity, and so was he. So anecdotally, he said in that situation, he would feel comfortable. So just kind of take all of that information in. But officially, there's really no change in guidance. We expect that it will come soon.
Other questions? Any other reporter questions? All right, Jess, welcome back. We're so happy you're here.
Thank you. It's been like musical chairs with all sorts of people in here, so good to see you all. Okay, so the first question is, can you explain the difference between efficacy and the percentage of people who might get COVID-19 after they're vaccinated?
All right, Hawk, let's take a swing at this.
Yeah. Well, I think, first of all, let's start with the second about the percentage of people who might get COVID vaccine. So we know that happens. We know that the number of people, the amount of people getting COVID-19 after that first or second vaccine, it does happen. But the curves, meaning the lines, the numbers of people starting to get COVID-19 after the placebo versus after the vaccine is extremely different. So even, 10 to 12 days after your first dose of the vaccine, and again, if we're talking about first dose, it's going to be Moderna, Pfizer, those numbers start to change dramatically from the people that got the vaccine to the people that didn't, meaning even though some people who got the vaccine did get COVID-19, it was nowhere near the amount of people who got it, who only got the placebo or didn't get the true vaccine. So that can happen, but it is certainly at a significantly reduced rate. And what are we talking about when we talk about efficacy? I think we need to define what we're talking about efficacy. Efficacy really, for the most part now with all 3 vaccines, have moved into basically how can you prevent severe critical disease, hospitalization, and death. And all 3 of these vaccines do an excellent job at preventing that. So that is why, if you have a chance to get any one of the vaccines, please go get them, because as far as vaccine efficacy goes with preventing critical illness and death, they all work very well in doing that.
All right.
if we are fully vaccinated and the people we are with are too, is it safe to go to a restaurant altogether?
All right, this is an outgrowth of our earlier one, Amanda. Do you think it's safe?
You know, I think to Dana's point about the intention of the vaccine was to reduce the severe illness, the hospitalizations and death associated with COVID-19. Is it safe? Can you eat around people? You can do it safely, and the likelihood of leading to a severe illness related to COVID, especially if you've been vaccinated, has been reduced. So I think there is that degree of confidence that you may still get COVID-19. Hopefully, if you were to get it, it would be less severe. You've talked about what is safe. It's relative to you and the risks that you're willing to take. So I think, can you go out to eat in a restaurant with fully vaccinated people? I think you can, but there is still some degree of risk associated with it.
Yeah, I mean, you know, I would still be concerned about, because we know restaurants, you do have a higher chance of getting the infection. So overall, you know, still what happens if you get the infection? Are you still going to have to isolate for 10 days? Are you going to miss work because of that? You are probably most likely protected from critical illness and death, of course. But you know, restaurants, unfortunately, because we all want to go back to the restaurants and be in the bars and be in the restaurant and eat with our friends and family. That's the kind of the question you have to ask. Well, even if I do get it, I will still be, you know, a little bit sick. Am I going to have to miss work or something like that? So it's still fairly a risky proposition right now, especially if the restaurant is busy. I mean, you know, you can go, certainly there are some times that are busier than others. If you can space from people, that's going to reduce your risk. And we're talking about levels of risk mitigation too.
Yeah, and if you get it, then all the folks that were with you, if they were within that that close contact definition, then they're going to be quarantined. So it's just something to take into consideration.
So here's my answer to this too. So my wife and I have had this conversation. We go back to restaurants, and I'm like, you know, I want to go. And she's like, nah, not yet. So finally, some of their friends invited us, and we were going to go out to dinner, and all four had been vaccinated. So it's just like the question. So we go into this place, and we go to the first room, and it is packed. And it's kind of the cool room. It's got the TV. There's a bit of a buzz going on, a little music playing and everything. Like, that's where you want to be, right? Because it's going to be fun, and it's just kind of a joyous. And you walk in, and you're like, wow, there's a lot of people in that room. And it just made me uncomfortable. And the tables were, sort of 6 feet apart. The back of the chairs were not always 6 feet apart. So we're like, no, I don't feel that comfortable. So then we went to another room, and it doesn't have the same environment. But you know what? Pretty empty. Sat in that room. Made me feel much more comfortable to be in that room. And I think that you got to figure out what your balance is, right? You got to find out what your risk are. All four of us, when we went out to dinner, are right around that 60-year age frame. We know that 60 is one of the big numbers for COVID. And, of course, I really only act like I'm about 20, and I think I'm really only about 30, but my chronological thing says, you know, a little older than that. And so you sit there in the restaurant and you think, okay, I feel better because I've been vaccinated. I do feel safer as a result of that. And then at some point you have to say, you know what? The data is what the data is. But one you have to think about is, what's your next step? So my wife likes to go see her mom. Her mom is 88. So if she got it there, can she go see her mom? Now, her mom's been fully vaccinated. So that actually figured into our decision. So had her mom not been vaccinated, we would not have gone. But now that her mom's vaccinated, she feels a little more comfortable with going. You have to weigh the whole story in your mind. It's really not a yes-no question. And everybody wants a yes-no question, but unfortunately, as with almost any type of illness, this is not unique to COVID-19. You could have asked the same question. I'm a bone marrow transplant patient. Is it safe for me to go out into a crowded restaurant? And the answer is, yeah, probably not. If you're a family member of that BMT person, bone marrow transplant patient, and you've just been, and your mom or dad just got transplanted, can you go to a restaurant and have to worry about bringing something back to your mom and dad? Yeah, you got to really be thinking about that. So the story has changed because we lead with COVID. But the reality is, this question is actually not new. It's been around for a long time, and it's really one about your own personal risk assessment. Man, that is a boring term. PAR, boring term. But that really is what the question is about. You have to decide what your risk is and how much risk are you willing to bring to those you love. And the question I would really ask is, have all those people been vaccinated? Or maybe they've had COVID. You could probably get there if they've had COVID within the last 3 to 6 months. Yeah. But vaccination, I think, is the better way to go.
Yeah.
Okay, someone has a spring break question. Susan says that she has heard many, many families say that they're going to be traveling to places like Florida and other spots this spring break. A lot of those people have not been vaccinated. She is wondering, is there a good chance of another surge happening in the next 2 to 4 weeks, especially with the new variant?
Yes.
Simple answer, yes.
Yeah.
Yes.
Yes. Lots of people getting together, not vaccinated. The only thing you got to hope for, not really, it sounds a terrible thing to say, but if a bunch of them have all have already had COVID. But the reality is, we know it's still widespread community transmission. You put people together, they start to drink, they imbibe a little bit. Pretty soon they're closer together, and pretty soon COVID is shared as well as alcohol and other things.
So,
To that point, though, I think there are a lot of families planning their spring break, and can you do it safely? And we know that driving is probably safer than going into the airport, although we've seen studies that suggest that airline travel is perfectly safe. But it's all dependent on the behaviors. If you're going into a situation where you see a large group, maybe you don't go to that large group, and you pick your path based off of your comfort level and what you're seeing with other behaviors. So I think there's ways to enjoy a family vacation safely. You just have to be very mindful of everything that you just mentioned about even going to a restaurant.
Yeah, you really these are choices. Like we said to our kids, make good choices.
And I would say that, we are always concerned. We hope it doesn't happen, but we're always concerned and ready for this surge, capacity-wise, employee-wise, critical PPE and drug-wise. So we always have that concern here in the health system and the hospital and regionally in our city in general. But we hope it doesn't happen.
And we have 85% of our employees have been vaccinated. How many new COVID positive infections are we seeing in our employees?
I think the rolling 3 to 7 days, one.
Under one.
Yeah, and
It's
what
like
was it?
0.85 or something.
Oh, yeah, we
It's
were in the
0.9.
teens at
25,
one
I
point,
think, at one point. Yeah, so it's a lot better. Okay, Jess.
all right, does the J&J vaccine contain a live virus?
Yeah, so just a little bit of pedantics here. So first of all, viruses are not live organisms, not like bacteria or fungus or us. We do say live because it's a lot easier to express that, but it's replication competent. And right now, no, the J&J vaccine is not a replication competent virus. Basically, viruses get into your body. They use your cells' machinery and other parts to help reproduce themselves. The J&J vaccine is not a replication competent virus, so it does get injected into you. The only thing that is really replicated in that vaccine is the spike protein, and that is what you are presenting with your cells to your immune system, is that spike protein to develop an immune response.
Replication competent, replication incompetent.
Correct.
You're a buzzkill at a party, aren't you?
Right. Not if I have enough
Oh, no, don't say that now.
imbibing.
Imbibing. But we wouldn't know about that because of COVID. No,
But it is
is
replication incompetent.
Can it make new viruses or not make new viruses? If it
No.
can't make new viruses, then it's not going to. It's not a live virus.
All right, when getting a COVID-19 test, does that include testing for the variants?
It does not specifically test for the new variants, no. Somewhat, sometimes we can see that. So the PCR test that we use actually looks at 2 different targets or 2 different areas on the genome. Sometimes we can anecdotally see a variant, particularly the UK variant, because one of those targets for the PCR will not develop or create a signal in that test. But in general, the answer is no, we aren't testing specifically for the variants, but we are able to send any concerning isolates to the state for testing should we need to.
Yeah, I was just going to mention that not every lab has the testing capability to do that, but you can send it on to other labs that are if you have a concern.
And we've sent some out.
We have, and the state is testing more to search for the variant, so I think that's important as well.
And they're testing wastewater, and they are seeing it in the wastewater in both Missouri and Kansas. So the variants are out there, and the idea that we don't have them, no, incorrect. We have them, so.
Yeah.
The Guardian reports a study in Italy showing that the Pfizer vaccine may be less effective in people who are obese. What are your thoughts on that?
Hawkeye?
I don't know. I'd like to see that. We know, and there's been a recent study about countries with higher percentage of obese people, certainly leading to more severe critical disease and death. I'm not aware of the the study about the Pfizer vaccine in general in obesity. I don't know how much is related to the vaccine and obesity, or if it's just obesity and getting the infection itself. So certainly can follow up on that.
Yep, sounds like we'll do a little bit more reading around that one. Have you seen anything? I haven't seen it. I heard about it last time, then I went home and I meant to read it. I didn't read it.
Okay.
I may have watched Star Trek instead.
Okay, I have a media question that just came in. I'm just reading as it got emailed to me,
Please.
so hold on one second. Okay, so this is from Fox 4. On Sunday, for the first time in more than a month, at least 29 states reporting rising case counts. Is that because of variants, relaxed restrictions, or something else?
I think the answer to that is going to be yes. When you start to see the numbers go back up, it may be the variant, and because the variants by and large seem to be respond to the vaccine, meaning the vaccine can help prevent spread. The only one we're a little nervous about is the 135 one out of what we call the South African variant, but really it's 135. But I think what I would look toward is other things as well. I think what we have to go back to is that the rules of infection control really do prevent transmission. And you've heard us say this before if you've ever been with us, but on our hospital ward with COVID positive patients, at one point over 100 of them at a time, how many employees got sick from
Yeah,
this
we were
source?
not seeing it.
We
We
should see it.
know that it was preventing transmission from a very acutely ill patient to our healthcare workers.
And so infection control works, and you just have to believe that. And all those people out there who are still doubters, who don't believe in masks, and like, really? How? We keep saying this to you. We didn't spread it in the hospital. And I promise you, if we didn't have infection control procedures in place, we would have made the whole place sick. But that did not happen. And why is that? Because infection control works. So when you start seeing rises in numbers, you got to think, okay, either A, people aren't wearing their masks, B, they're getting together again, C, they're going outside or doing stuff when they're sick, D, they're not keeping their distance, or E, all of the above. And I think the answer is all of the above, right?
I think there's a big behavioral component to that.
Yeah, we know the behavior changes outcomes.
Okay, the next question is, are you all nervous about the Brazil variant? The New York Times says Brazil is seeing a record number of COVID-19 deaths and the spread of a more contagious virus that may cause reinfection.
You know, I am a little nervous about this data coming out of Brazil. The problem is, when I've read it, Hawk, it's a little hard to know how many people have been successfully vaccinated. Remember that Brazil used the Sinochips vaccine from China, which turned out to be less than 50% effective. They also had some other vaccines, so their whole vaccine story is a little muddied. And then on top of that, there are behavioral questions, whether or not there's got a lot of mask wearing. So I am nervous about it, but I think there's probably a milieu, a composite of factors that are leading toward this.
I would agree 100%, yeah.
So I think it's something that we bear watching. I think we have to continue to study it. I think what we have to also do, and we made this comment earlier, you know, wastewater in America is showing a rise in variants, and yet overall the infections are flat. Now, there are some upticks, and I don't know if the states that are uptaking have changed the variance numbers either that they've been testing for or in the wastewater, but I think that's an important question and one we'll try to research.
With most nursing home residents now vaccinated, including my mom, when will it be safe to visit her? I've had both doses of my vaccine too.
Yeah, that's also a great question. And I think, guys, I'm going to turn to you. What do you think, Amanda?
Well, I think you made a really good point earlier. If the nursing home, it's going to be dependent on their visitation policies and if they've raised their restrictions, and that might be driven by their county health department. But you mentioned earlier that your wife is going to visit her mom, and I think that, again, that can be done safely and is probably much needed, considering the length of time they've probably not had a visitor. So I think it can be done. I would probably still maintain some degree of social distancing during the visit. Maybe not eating and drinking together, but obviously you would be able to give a hug and welcome and just spend some time together.
Yeah, no, I think I would agree with all that, and hopefully soon real world experience with not only healthcare workers vaccinated, but the other general population, especially those most vulnerable populations in the nursing facilities. We will have some evidence of what happens when people are getting together, when the nursing home facility patients or those vulnerable people are vaccinated, and maybe other people are not, or when both parties are vaccinated. That will help us guide to have a better answer about when you can feel safe about doing that.
And I think the key is, remember, you're protecting all the residents in that nursing home, because even if you could spread it, because you can still spread the disease, and you're usually asymptomatic because the vaccine doesn't stop, it helps reduce markedly, I think, the risk of transmission, but it does not eliminate it. And so you just, that's kind of the hesitation, and I think nursing homes are still feeling a little bit vulnerable around the earlier things that have come out. And about 85 to 88% of residents in nursing homes have accepted the vaccine, but there are some that have not. And also, the other thing that's a little interesting, only about 65% of nursing home workers are taking the vaccine. Yeah. So that's a little spooky, too. You're like, come on, guys, let's get this done. And I think that, again, it's all about the risk-benefit ratio. And I think most, my mother-in-law is a resident over at Bishop Spencer Place in independent living, and they've done a great job. Peter Holt's one of the CMOs we work with, or St. Luke's CMO over there, and has just done a great job. And that whole team has done a great job of trying to keep their residents safe. They really have not had an outbreak. They've had 2 or 3 individual patients who have had it, but then they've been able to keep it safe. And so they've gotten, I think, just about everybody vaccinated there. So they are considering opening back up again. I don't know exactly their timeline, but they mentioned they hope to and they've been able to come in and have a visitor with masks 6 feet apart in a lobby in a kind of restricted setting, but they're talking about letting a family member go back up to an apartment. I don't know all the details around that, but I think all nursing homes are starting to think about this as well, because we all need the human touch. So let me ask you guys a question. Start with you. Are hugs dangerous?
No,
I don't think they're dangerous either. Thank you.
And I think you can. Usually a hug isn't 10 minutes.
No. Well,
so even if you're hugging,
it's not just a hug. Let's be honest here.
You wouldn't be a close contact unless you're like sneezing, coughing,
right,
transmitting mucus.
Yeah. Can you shake hands again?
Clean hands, yeah.
Yeah.
Why not?
Just grease your hands down. What do you think? Are hugs dangerous?
I think empirically, no. They are not.
I don't think they're dangerous. I still want to give hugs, but I'm a hugger, and not everybody is.
1, 2, 3 second hug, you're not going to have any.
Yeah. I would like to say that hugs are never safe because I'm not a hugger, but they are safe.
Not a hugger?
See, I'm a hugger, and this is who I am, and I've grown up that way, and it's like,
the world needs a hug, and you're not a hugger?
Man.
And to the nursing home point, Stephanie Harrington, my administrative assistant, she is visiting her grandma, who she used to spend, every week with, for the first time this Saturday. And she gets to spend the entire, early morning to afternoon. Great. So just the amount of joy that will be brought to that family is immense.
Stephanie Harrington, don't know if you're listening, but bring the joy. That is the best.
I'm hoping to see my 97-year-old grandmother this spring.
All right. Bring the joy.
Yeah.
So. Bring the joy. All right, Jess, bring the question.
All right, here's an easy one for you. A friend won't get any of the COVID-19 vaccinations, saying they alter the DNA. Please tell me that's a myth.
It's a myth.
Complete myth. It's 100% false. First of all, so the Moderna and Pfizer are mRNA or modified RNA. Some people say messenger RNA. Those basically get injected. Your cells take up that, and in the cytoplasm, that's not where your DNA is. Your DNA is in the nucleus. In the cytoplasm is where the RNA is transcribed and made into the spike protein, so it doesn't even reach the nucleus where your chromosomes and DNA are. The non-replicating Johnson & Johnson adenovirus vector vaccine is, again, non-replicating. It does get into the nucleus, but we know that adenovirus does not incorporate into your DNA at all. Basically, the DNA there is just transcribed into RNA, which then goes back out into the cytoplasm. It's then transcribed into translated into the spike protein to create the spike to make that immune response. So the overall answer is no, there is no incorporation into the DNA. It does not alter your DNA at all. They are completely safe from that aspect.
I think Dana makes her job way more difficult.
I try to use as many syllables as possible.
Unless he's talking about replicating or non-replicating.
Okay, I have, well, let me ask you this one. Military officials recently told Congress that about a third of younger active duty and National Guard troops are refusing the vaccine. Is this a concern with military families moving all over the country and the world?
Yes, I think we need to figure out how to target the vaccine hesitant population here, because it's really important that everyone get a vaccine, so.
And then you go around the world, and let's say you're going to a third world country or someplace where they don't have much vaccine yet, and
Yeah.
you're like, gosh, guys,
Could
this
lead
is
to
not a good idea here.
devastation, absolutely.
Yeah, not a good thing, and then you're going into a relatively unprotected
Yeah,
group.
we
so.
can't have the people who protect us on a daily basis get ill and be unable to help.
And not protect themselves.
Yeah.
I mean, that's the question. It's funny, because even here, we've had 85% uptake. We have not had 100% uptake. Why do you think that is?
I don't know. We had a phone call the other day. There are folks that are just, there's not enough information. They want to see more information. They think it's still in the experimental stage. So there's still some degree of skepticism that we just need to overcome with facts, which we are starting to see more and more facts of the efficacy and the impact. I mean, I think our data, our numbers over the last 2 months have really demonstrated some success. So I think folks will get on, but with every change, you're going to see earlier adopters and late adopters.
So how many vaccine doses have we given so far? How many
Just
shots?
over 30,000.
30,000, I think.
Yeah, and how many bad outcomes have we had from those shots?
Sore arms and
sore arms.
chills.
Yeah, I don't think we've had any. There was a report yesterday on our chief medical officer call of one person in one of the mass vaccination centers having gotten anaphylaxis and getting pretty sick. They had to have a couple of epi shots. After that, by the time EMS came there to take him to the hospital, they'd fully recovered and they went home. So that's the worst thing we've heard in Kansas, all of the shots being given in Kansas City. So, folks, this is safe, and you have to believe that it's safe. And I know that some folks worry about being experimented on. And especially, I think, in an African-American tradition where that has been something that has happened. There is institutionalized racism, and it's clearly true in healthcare as well. And I think one of the things that has happened is some segments of society have been experimenting on prisoners, African-Americans most notably. And I think that people look at that and they say, gosh, I don't want to be experimented on again, and fully understand, maybe I don't fully understand, but hear that viewpoint. I think that what's different about this is we are offering this to everyone. So that would mean that every one of us is being experimented on, number one. Number two, the experiment isn't really the vaccine. The experiment is being unprotected in a world of COVID. And because that's where you're throwing the dice. And so you're throwing the dice more to be unprotected around COVID, or you'd be throwing the dice more to be vaccinated. And yes, we say that the rules of infection prevention control travel with you and they protect you and they can take care of you wherever you go. And that is true. But you have to be 100% constant vigilant all the time. The vaccination does allow you to go a little bit more back to normal and helps you know, at least it improves the odds of you're not spreading it to other people you love and care about. So vaccine hesitancy is real. I do understand that this is not an FDA-approved drug. It's an early use authorization and under an emergent time. But you have to sit back and say, now, millions of people have received this dose around the world, 30,000 people right here at KU. And what I want, we've tried to work hard to tell you the truth all the time. So we're telling you the truth here. We just aren't seeing the bad side effects, and we're months into this, which means that by now we would have seen those side effects because that's how vaccinations are. You're either going to get the side effect or you're not. And so we're safe. So ask yourself this question while you try to explore your hesitancy and think about whether you want to get the vaccine or not get a vaccine. Are you safer with the vaccine to protect you against the greatest infectious threat to mankind in over 100 years? Or are you safer without a vaccine?
And I think to your point, which was great, I was just going to say the CDC actually reduced or lessened their restriction on severe outcomes or anaphylaxis or reactions to components. It was the polysorbate that they recently reduced and said it's not as much of a problem now. And, there's just loud misinformation voices out there, and there's so many ways to get that misinformation as well. So I think those are the other things to
Loud
consider.
misinformation. That's a good term. That's much better than non-replicating.
Yeah, well.
I like that, loud information.
And I would like to say, too, one of our sign interpreter, Michelle, she said, she talked about the phones, and there's probably a lot more control going on with your phones with tracking and listening to everything you say, talking about something and then looking at a news article and you have an advertisement for
Right.
something you were just talking about. So there's a lot more, I don't want to say intrusiveness, but there's a lot more of that going on with people's cell phones that they work with multiple hours a day with. So.
On what you were just talking about, Dr. Stites, Karen asked, do you know when the FDA will convert to a full authorization, therefore helping some of those hesitant
Yeah.
people?
It takes a while because they want to have more information for long-term follow-up around, and remember the vaccines have just really rolled out, right? This is what we call post-trial surveillance. So you've completed all the drug trials, you got an early use authorization, now they continue to watch for it. I think it's going to be a while. I think it's going to be another 6 or 8 months.
That's what we talked about, yeah.
And Dr. Bahoud from Children's Mercy had talked about that. We need to get her back on this program because this is something that she's really the expert in, and I think it would be great to have her or the gentleman in Holland, I think, from Mayo Clinic back on. We'll address this question a little more thoroughly, but I believe we can expect it'll take another 6 to 12 months, and that has to do with post-marketing surveillance to look at all aspects of a drug rollout, whether it's a vaccine or any other drug.
If someone has been fully vaccinated, will that affect the results if they do need to be tested for a possible COVID-19 exposure?
Amanda?
They will still show positive if they have
Yeah.
active infection.
Yeah.
Yeah, I think we have to tease out exactly what that question is asking. So just getting the vaccine will not cause you to ever test positive for the virus. If you've been exposed and you actually do have active infection, we hope that it will certainly reduce the amount of replication going on, so you may not be positive. But again, because we know that even asymptomatic infection is reduced in people who have gotten the vaccine. So hopefully it'll affect it in a positive way, meaning you won't really have the infection, you won't get symptoms from it. But just getting the vaccine will not cause you to ever test positive for the virus.
But if you do have active infection, the vaccine also won't mask your positive
Correct.
test.
100%, yep.
So Sean wants to know, is there more data, or when will there be more data on if people who are vaccinated are less likely to spread COVID asymptomatically?
Yeah, I think more data keeps coming out all the
yeah.
time, and the data gets more and more favorable all the time.
Yep.
But I think it's going to just require time to really fully understand the dynamic of that.
Yeah, absolutely.
How long do you think before we might have even more of a clear answer?
Well, again, the best real-world data we have is from Israel because of their rollout and their ability to vaccinate so much of their population. But I'm hoping now that with, especially with the United States, we'll have more, healthcare worker data behind that, but also general population data as well.
And the healthcare worker data so far looks really good.
Yep.
Yep. Okay. Listen, on Monday, Dr. Kenny Southwick, who's the Executive Director for Cooperating School Districts of Greater Kansas City, will be with us talking about vaccination of teachers, along with Dr. Jennifer Watts, a pediatric ER physician at Children's Mercy. Dr. Watts has been with us before. This will be, I think, a great program. I believe David Weil will be substituting for me because I'm going back to the dentist. What a joy from COVID-19. I'm going to go back and, get that tooth thing done. So it'll be a great program, and I think that'll be really important because we really want to talk about the vaccination of teachers. Amanda, final thoughts for today?
It's going to be beautiful this weekend, so hopefully folks can get outside and be safe.
Yeah.
Wear sunscreen in addition to your mask.
All right, absolutely.
Yeah, I would agree. If you can get outside, be active, but do it safely and continue to hopefully cause our rolling 7-day average in the Kansas City area to be going down, hopefully reducing spread of the disease, hospitalizations and death. And we know that more and more vaccinations are being rolled out to the general public, so we hope that will continue, and overall that's going to be a good thing for us.
Yeah, we have a busy vaccine weekend this weekend.
All right, that's also great
Yeah.
news.
Yes.
All right, so remember, it is going to be beautiful outside, and gosh, we want to go, right? We want to go. But faith, hope, and science are getting us to a better place. And the other thing that we heard yesterday, charity. I like that. We may have just added another braid to our rope. That was pretty good. And when you put on a mask and you go outside, remember, what does that mask really say? It says, I love you. We'll see you next week.